If you have a cold or the flu and you have Parkinson's, then you need to listen to this. So a question I get a lot this time of year is it safe for me to take over-the-counter medications for my cough, my flu, whatever it is? And the answer is it depends. Of course, if you read the label or go to Google or ChatGPT, the blanket statement will be no, because it's a little bit of CYA, but it gets a little bit more nuanced than that. And especially since I have a large YOPD community here, I would say there's a little bit more room for nuance here. Of course, as always, this is not personal medical advice. Always, always please discuss this with your own doctor because there are unique medical histories, backgrounds, other medications, interactions, etc. But I'm just going to give you an overview. And because it is a little bit more complex and nuanced than yes or no, this is going to be a longer reel. So I think what I'm going to do is break it down. And first in this, I'm going to cover what are considered the dangers and how dangerous are they really. And I'll do a part 2 in terms of what medications are safe. And I know the medicine aisle at the drugstore can be a scary place. You have Parkinson's. So I want to provide some completely safe options that you don't have to give second thought to. So I'll move on to the dangerous things now. So those fall into 3 categories. These are the things you're going to look out for. One, it's a cough suppressant called dextromethorphan. You'll see it abbreviated on the label as DM. The second are your decongestants, and those are pseudoephedrine and phenylephrine. And the third category to look at for are anticholinergics. Most commonly, this will be Benadryl, diphenhydramine, and some other ones as well. So why are these dangerous? Really, these are dangerous, the first 2 categories, if you are taking an MAOIB inhibitor. Maybe. I'll explain why the concern is there. So MAOIBs, those are your Azilect or Rasagiline, your Selegiline, and if you're taking Xadago, otherwise known as sulfonamide. So what MAOIs do is they prevent the breakdown of certain neurotransmitters in our brain so they hang around longer. What's important to know that it's a broad category and this warning is a blanket statement because this group of drugs is divided into an A group and a B group. And that's where the critical nuance distinction is. So with the B group, the one that you're taking in Parkinson's, your Rasagiline, etc., is working primarily on dopamine. The A category, that is working more on serotonin and norepinephrine, and that's where the risk lies. This is what increases the level of serotonin, and if this is combined with dextromethorphan, it can really increase the amount of serotonin in the brain. So why are we applying this risk for the whole category here? Well, because there is still some theoretical risk of some mild serotonin inhibition, even with the B category. And the Parkinson's meds are at low doses. They're not at high doses. So the theoretical risk is super small. But if you look at it from the FDA point of view, they're looking at the fact that one potential outcome, however rare, could be a crisis called like a serotonin syndrome, where you have super high fever, 106 and above, rigidity, and some confusion. And nobody wants that. So weighing cold symptoms versus potential life-threatening thing, FDA is always going to come down on safety. So that's why that's there. But there's some discretion to decide that you can decide with your doctor about that. Now, the second category is the decongestants, which they work by vasoconstriction. So they're going to increase your blood pressure. Now, if you have Parkinson's, you might be on medication to raise your blood pressure. And you'll hear about that more in the series I'm doing on blood pressure issues in Parkinson's, which I recommend that you follow to better understand this. So this dovetails very nicely. Now, you could argue, well, don't we want to raise blood pressure in Parkinson's patients anyway? Yeah, so there is room here, especially if you're young onset and healthy. Taking a couple doses is probably okay in certain circumstances. Again, it depends on your individual thing. This is not medical advice. But there is a little bit of flexibility here that you can talk about with your doctor. The concern is that a lot of people's autonomic nervous system is not working. If you have a sudden spike in blood pressure that you don't compensate well, your heart doesn't respond appropriately. And what happens when you're sick, you lay down. And the thought of having really high blood pressure while you're laying down and sleeping, there's the potential theoretical risk of a brain bleed. Does that happen often? No, it does not. Could it happen? Yes. But it's one of those, let's always put safety first. Is it likely? No. But this is a potential outcome, and we're talking about cold symptoms. Now, we also know that if you are very sick and suffering and just absolutely miserable, it's going to make your Parkinson's symptoms worse overall. So that also has to be weighed into the equation. So with those categories, the MAOIB ones is really at risk. Levodopa, I would say for the most part, is generally quite safe. Is there always some potential? Yes, very small. I wouldn't worry about it too much. And that brings us to the last category, which is the anticholinergics, Benadryl, etc. And why? Those are usually in the nighttime formulations, PM, to help you sleep. And in someone who's already kind of elderly or dealing with cognitive impairment, there's a high risk of confusion with that, especially when you're sick and you're kind of not doing well. And it can worsen your constipation and urinary retention, etc. So that's where that warning comes in from. So I hope that makes sense. Of course, someone who's younger will be a lot more tolerant of that than someone who's older and already prone to some confusion. So again, there's some room for nuance there. And everyone has different risk tolerances, as do their doctors, and that's something to discuss with them. So I hope that helps. I know that was very lengthy, and hopefully didn't leave you more confused than enlightened. But if you have any questions, please go ahead down below and go ahead and ask them. And I will post a second reel now talking about remedies that are considered completely safe. All right, see you there.